Hello, my name is Dr. Jason Smith, and in this brief video I'll be sharing with you what the current medical research reveals are the most common presenting symptoms of COVID-19. But before I get into the content of what I've prepared to share with you this week, I wanted to mention two things. First, I just wanted to tell you thank you all for your flexibility and patience as you've been coming into the office the past few weeks. We've been wearing masks and we've been sanitizing and washing our hands and keeping patients in the parking lot till they come in for their appointment and separating people into different rooms and basically just trying to stay positive and upbeat as we deal with this major inconvenience and a new way of living, and for me a new way of practicing and seeing patients. I'm not a real big fan of living in fear, but I have to admit that this has even affected the most stout of heart. I still consider it an honor to be able to use my knowledge and my experience to help you. Some of you have had emergencies and flare-ups and injuries over the past few weeks, and I've been able to help some of you get through it. What I've noticed is that people not only are having more physical challenges, but they're also having mental and emotional stresses as well. People aren't sleeping as well. They're not able to relax as well. But one of the reasons I think is I think in some ways we've spent so much more time on screens than even we did before the COVID-19 pandemic hit. Parents are spending more time working at home and doing Zoom meetings for work, and then kids, of course, are doing Zoom meetings all day to get their schoolwork done. And I've talked to some of the parents and even seen some of the kids in my office, and they just sometimes have this glazed look where they are just tired of looking at screens. So the other, I basically think this has really affected not only our whole culture and our society, but it's also affected our brains and our bodies as well. So the other reason I wanted to explain is why I'm even doing this video. I have so many patients that haven't been able to come in at all to see me and have treatment in our office. But lots of others have been able to, and I've been sharing some of the research I've been learning. And as I share it, some of my patients have told me, you should let the public know this. Let some of the other patients know this. Can you let some of my family members know this? And so I decided I was just going to put a few things together, some of the research I found, and try to avoid being lazy and avoid the fear of getting on video and just put it together, and here it goes. So what I found and downloaded is several articles that help me understand more about the nature of this virus, what kind of people it affects, what are some comorbidities or things that people have, and what we should be on the lookout for, and more importantly, what we can do to improve our health and resilience so that we don't become a statistic. So forgive me for referring to my notes, but I just want to make sure that the statistics I share with you are accurate. So first, let me ask you a question. Based on everything you've learned or read or studied over the past several weeks and maybe even a month or two, what do you think is the top symptom of COVID-19? If you answered fever, that's partially correct, but you're not alone. That's pretty much what the initial symptom was identified by the CDC. But according to the CDC now, fever is the third most common symptom. Initially, they listed it as the top symptom, but it was so widely accepted that in certain places, as patients showed up to get tested because they thought they had COVID-19, they weren't even allowed to get tested because they didn't have a fever. According to a study by Richardson in the Journal of the American Medical Association, they used data from 5,700 different patients in over 12 different hospitals in the New York City area. They found that up to 70% of people with COVID-19 that were diagnosed with the virus, an active infection, did not even have a fever. Boston's Brigham and Women's Hospital has been tracking the presenting symptoms of COVID-19 for the past several months, and their guidelines are used by clinicians across the United States. They note that, quote, presentation can be extremely varied, unquote. And they list the most common symptoms as follows. So these are the top 10, and I'll read these. Fever, cough, loss of smell or taste, shortness of breath, upper respiratory symptoms such as sore throat or runny nose or nasal congestion, fatigue, muscle aches, headache, confusion, and GI symptoms such as nausea, vomiting, and diarrhea. So using this list, along with the one maintained by the CDC, it appears that the most common presenting symptoms of COVID-19 are number 1, loss of smell or taste, number 2, cough, and number 3, fever. It is worth noting that the most common presentations in adults are not exactly the same as they are in kids. For example, in one hospital, only 51% of the children that were admitted had cough and fever. That means 49% had maybe fever, maybe cough, or some combination of the other top 10. Gastrointestinal symptoms are more common in kids presenting than they are in adults. And there's a study of 48 kids hospitalized with COVID-19 that found that the vast majority of them, over 83%, had some other pre-existing condition, or a neurodevelopmental condition, or neurologic disorder, something like cerebral palsy, or tracheostomies, or feeding tubes. The last thing I want to mention is the vast majority of people who have died from COVID-19 are those with comorbidities. And for those of you who don't know, a comorbidity is defined as a simultaneous presence of 2 or more chronic diseases or conditions in a patient. So the top several comorbidities that lead to fatalities are as follows: hypertension or high blood pressure, diabetes, respiratory disease, obesity, and those who are morbidly obese. But the question is, why are these things that make us more susceptible to coming down with COVID-19? It's because when you have more than one of these, it's so inflammatory. It puts such a load and a burden on our immune system that it makes the immune system not as flexible and able to respond and resist an infection, a novel virus infection like COVID-19. So I'll continue to update you as I learn more about the virus and the disease and its various causes as I look at the research. My feeling is that this COVID-19 pandemic is a wake-up call for many of us. If you agree with me, then I challenge you to think of at least one thing you can stop doing that makes you more likely to be sick, and think of at least another thing that you can start doing that can give you more health and resilience. You should be thinking of things in these 3 different categories. First is how you think. It's what you're putting into your mind, what you're following, what you're paying attention to. What I've realized is looking at a lot of the news and the headlines doesn't give me confidence and gratitude and make me feel calm and relieved. It usually creates a little stress inside. So the things we think about are really important. The second is that how we move our body every single day. If you're not exercising, start. Find something that you can do, and you don't have to decide to do something 60 minutes every day. Start with 5 minutes or 10 or 20 and get a habit generated where you actually are moving your body more than you used to. And the third thing is the food and the drink you put into your body. Avoid the sugars, avoid the things that will make you more inflamed, and put good stuff into your body. I like the things that are like 1 ingredient foods, like broccoli and beef and chicken and different things like that. Eat things that are 1 ingredient foods, and then if you start to do that and continue to do that every day, you'll be actually earning health, which is basically a byproduct of things you've done in the past. It will give you the resilience you deserve, and you will be able to live your life in happiness and gratitude and not live in fear. So I just encourage you to make it a great day. This is Dr. Smith signing out. Oh, and make sure you check out my next video where I'll talk about a medical device that costs less than $30 that every single person should have in their home. And I'll teach you how to use it and what are the things you need to know so you can pick up on some early and common signs of COVID-19 before it progresses to something called COVID-19 pneumonia, which can be silent and it can be fatal in some cases. So thank you.